Hello and welcome back to the Nutrition and Life podcast. My name is Lisa, I'm your host, and today I have the pleasure of speaking with Dr. Tom Ingegno. He's an acupuncturist, owner of Charm City Integrative Health, author, and podcaster. Welcome to the show, Tom.
Thank you so much for having me, Lisa.
Yeah, I'm excited to talk about all things holistic health, integrative health, Asian medicine, but also, of course, your latest book, which is the Cupping book. And that's actually, of course, well, before we get into the book, I want to hear more about you, just how you got to where you are today, but then maybe finishing off with
Mhm.
what inspired you to write this book.
Well, yeah, thank you for asking that. That's kind of like a big story, but I'll try and keep it relatively brief. Yeah, I was set up to be a medical doctor, an MD, and as I grew and got older and was headed to college, I saw some holes in the Western medical system. Let's say it really wasn't preventing disease; it was just trying to manage symptoms, and it wasn't really looking for those root causes. And specifically, my grandfather was a pharmacist, and I remember him counting out pills one day, and it was for somebody who was a day laborer. So here, somebody that may be undocumented might hop on the back of a truck and do work for a day and be handed cash at the end of the day. And this guy had to take three of these pills, which in the early 90s was $5 a piece. And that's a huge chunk of his budget, especially when he's trying to, take care of a family and, he's busting his hump and he's got to take these for the rest of his life. And my grandfather actually looked at me and said, there's got to be a better way and I hope you find it. Right. So he kind of put this bug in my ear that I completely forgot about. Um, about a year or two later, he died and I kind of blocked that off. And when I was in college, sitting in, the prerequisites, your biochemistry, your organic chem, and all of those classes, that kind of came back to me. And I was like, maybe I should be looking into alternative medicine. I still thought you had to be a medical doctor to do that, right? We know there's so many ways that you can help people, so many different degrees, so many different certifications that people can go and get and actually have a positive impact on people's health. But still in my head, it was like, no, these are the letters you need after your name. This is how you do this. This is the system. And then during my junior year of college, I got a postcard in the mail from an acupuncture school. And there was an open house around Christmas. I was signed up for it before we went back to my second semester of my junior year. And I never looked back. I mean, it's been such a great field for me, and to be able to spend time with patients is probably my favorite thing, right? We're not rushing somebody in and out. We're talking about every aspect of their life, their sleep, their mood, their emotions, what's going on in their family dynamic, if that's relevant. And that's not something that we look at from a Western standpoint, right? We know all these core things from a much more like pulled back and how are we doing these holistically. We know that what we put on our fork has more to do than what we go and get, a blood test for once a year, right? So those little things that we're doing all add up to our overall health. And East Asian medicine really likes to explore those and understand those, to understand how a person got to their current condition and how to move them back to where they need to be, vibrant and healthy. So it was a beautiful, I guess, coming up story for me where I got to explore all this. And for the past 20, almost 4 years now, I've had the pleasure of doing this as a career.
Wonderful. Well, I thank you for sharing the backstory also, especially in regards to your grandfather and just in general what your why is behind it, your driver behind it, and just also for explaining a little bit more about East Asian medicine and the inspiration behind that. When I think of East Asian medicine, I often think exactly like my ear hurts or my liver hurts or something like that, and then someone does something with my toe and somehow it heals my ear or my liver. Like it's that is kind of what I'm connecting with this, and really, as you said, like getting to the root cause of it and not just thinking, okay, the ear or the liver hurts, here's a pill so that it won't hurt anymore.
Hmm.
I think Western medicine is wonderful when it comes to treating things acutely, but when it comes to preventing things, when it comes to really finding different angles and more holistic or lifestyle approaches as well in terms of curing things, not so much, unfortunately, but thanks to people like you and practices that you have at your clinic, we still can benefit from some of those. And yeah, one of the, I guess, maybe not, definitely not newer ones, but one of the ones that have become more popular certainly is cupping in my
Mhm.
I don't think 20, 30 years ago it was as popular in the Western countries as it is now. Of course, correct me if I'm wrong, but
No, no, you're absolutely right.
yeah, I would love to really get into that quite a bit because sometimes you see people walking around and they have these bruises and you're like, oh, what have you been doing? Oh yeah, I went cupping. And that's kind of like the extent of knowledge that most people have about cupping. So why don't you enlighten us in regards to the mechanisms of cupping? Like how does it actually
Yeah.
work? And then just maybe going into applications as well.
Yeah, so cupping, if we call it by a more Western sounding name, they'll call it a vasonomatic decompression, right? So it's the cup goes on and it's pulling up. We create a vacuum, right? So what happens? The physical response is the skin goes into the cup, it pulls away from the fascia pulls away from the muscle, and because the system is closed, something has to come in there, right? So fresh blood gets pulled into that area. Now, modern studies are showing that can happen up to 6 inches into the body. So that's pretty significant, right? So for most people, if we put that on their back, that's affecting the tissue and blood flow to the front. Now, one of the things that cupping does so great is get circulation into an area, right? So by pulling that and creating this kind of vacuum, even though it's not a vacuum inside the body, it'll increase that flow there, which locally does cause a little bit of inflammation, but kicks more circulation throughout that whole area. So with those broken capillaries at the surface, right? That's kind of what that perfectly circular hickey is. That's what that bruise is. But within that, the main effect is happening deeper in the tissue. We're creating fresh blood into that area, which reduces inflammation, brings oxygen, brings nutrients, and increases circulation. So we're going to wash away metabolic waste, uh, inflammatory markers like cytokines, get flushed out of that tissue. So people love to use this for pain relief. But we can also help with immune system response, specifically with chest congestion, bronchitis, pneumonia, those kind of things. So because we're increasing that circulation up to 6 inches, that's going to hit the lungs as well. So this was a traditional use going back thousands of years. And in fact, I don't know when last time you've seen the Godfather series, but in the second Godfather, Fredo, when they're going to flashbacks of him as an infant, his grandmother is doing cupping on his chest because he was sick as a child, right? So these chest things. So it was really associated with, in Zorba the Greek from the 1960s, they were doing a cupping scene. So it seemed to be like have this Mediterranean feel to it. But to tell you the truth, we're not exactly sure where it comes from. The earliest writing that we have is ancient Egypt, 1515 BC, right? In the Ebers Papyrus, which was a real medical manual, right? They talked about surgery in that book and looked a lot like modern day surgery, given slightly different tools, but the techniques and the procedures were very similar. We know that the Persians were using cupping. We know that Hippocrates wrote a ton of cupping, but we don't exactly know where it came from. We know it went all over the world. When I was teaching at a school in Manhattan, we had a lot of foreign students. It didn't matter what country they were from, whether it was a African country, if they were from Asia, if they were from Europe, they would always say grandma used to do cupping, right? And we even know that in South America, around the same time, thousands of years ago, they were doing ventosa, which, like means to suck, which is what we're doing with cupping. So it's a very interesting thing that this kind of did this idea come from one place and then it was shared, or did it kind of pop up through different cultures because we all kind of think the same? It's just a super interesting thing that we will probably never figure out. We're not going to know, there's no book when here's where it all started, but it's exciting. And even Chinese medicine, they were using it in ancient China, but they didn't write about it, should I say, the physicians didn't start considering it anything more than folk medicine until about 300 AD. So they were like, oh, the people at home do this before they get here. And then one physician finally said, this is a very powerful healing technique. We should be including this in our practices.
Wonderful. It is completely new to me that it goes that deep.
Yeah.
I seriously thought it is more like a fascial therapy in the sense of not necessarily superficial, but like
Yeah.
certainly more applicable to the skin and the muscles, yes, but not as deep as six.
Not as deep. Yeah.
That is
Yeah.
very
And this is why we can use it for digestive disorders too. It's pretty
amazing.
impressive.
I did
Now,
not know.
musculoskeletal stuff is the number one thing it's known for. And certainly a lot of the modern studies all indicate that neck, shoulder, low back pain, and
So
being
yeah,
that it's such go
I,
ahead, sorry.
I would love to go there a little bit more because most of our listeners they are involved in some sort of physical activity.
Yeah.
Most of them resistance training, some endurance athletes as well. So in terms of that, where would be the best application in the sense of, oh, I'm really sore, I'm going to get cupping done today, or should I
Yeah.
wait two days? Or an athlete who is in season, should they not do it at all? Yeah, what might be some
Yeah. So
contraindication?
if you look at the current Olympics, the last Summer Olympics, they were getting cupped, almost after finishing routines or after they finished swimming. Both of those are okay. We actually don't have data like that. We don't have data that says, oh, wait 2 or 3 days. Traditionally, it was like when you felt the pain or the tightness, that's the best time to do it. In fact, at my office, we imported a lot of different cups. My book talks basically about cups that don't require you to use fire. We do fire cupping in our office, but for safety, we have so many modern tools. They're silicone, they're plastic. You don't need the fire. You don't have to worry about glass breaking. Those silicone cups are one of my favorite things to have athletes take to the gym with them as part of the workout stretch recovery. Maybe you did a lower body workout, your calves, your quads, your hamstrings are really tight. The silicone cups come in so many different sizes that we can get smaller muscle groups like we couldn't get before. And because they're a little bit more pliable, rather than having to need a broad flat surface, which hard cups need, you can take these silicone cups and get them on a forearm, on a calf, and it doesn't have to be somebody that's big and bulky to get the right suction. Certain areas will bruise more than others, and that's just more superficial vasculature, but you still create that space and that fascia release that you'll see some great improvement with.
Amazing. And what would be some contraindications then in the sense of when should
Yeah.
we not use it?
Okay. First and foremost, and I've seen celebrities while they were pregnant getting cupping. I'm not going to call them out by name. We don't have any research on there, any of that. It would be unethical to study. I can't say it's bad, but we don't want to rock the boat in somebody that's pregnant. It's safer to not do it. Um, Deep vein thrombosis is a big one. If you have a vascular disease, do not cup in that area and make sure you're not doing it at home in this case. If you do decide to get cupping, talk to a healthcare professional, probably your primary care first, and then whoever would be performing the cupping, tell them what's going on. Certainly, I don't know too many hemophiliacs, but people with clotting disorders, people with blood disorders where they're not going to be able to stop bleeding, or people that are on a high amount of blood thinners, maybe not your best modality. And then open wounds. They sell a little snake bite kit that has like a cup with a pump on it. I don't know if that works, but I wouldn't cup on any open wounds, any skin lesions or things like that. Probably better to leave it alone and go to a dermatologist.
This is, yeah, super interesting, particularly also in regards to being able to do the cupping yourself after
Yeah.
the gym. I'm definitely going to look into some of those silicone cups myself because I'm just yeah, I'm more quite experimental. I like try new things. So thank you for that recommendation. Um, Adding on to the point of pregnancy, because I hear a lot from women that are pregnant that they get acupuncture done, and you
Yeah.
are someone who also practices acupuncture. So kind of transitioning a little bit into that realm. Um, Overall, what is there to say about acupuncture, or
Hmm.
perhaps applications in contrast to cupping? When would you
Yeah.
use one or the other, or also other things like dry needling, etc.?
Yeah. So first and foremost, this is kind of an interesting tidbit. One of the largest documented and studied part of East Asian medicine as a whole, and that includes Chinese medicine, is women's health. And a lot of this, this is not a feminist movement. This is you need to have a big family to run a farm, or the emperor needs heirs, or something like that. So, not the best origin story, but it gave us a lot of great studies on menstrual cycle. And when I say studies, I'm talking thousands of years ago, not modern day, double blind, placebo controlled, but case studies and a lot of research on how to regulate menses, how to have people have periods that were not painful, all of the things that might send you to a gynecologist, acupuncture can support, right? And then with Chinese herbal medicine, giving you herbs to support other issues or maybe more severe issues. I have to say, without advertising and without saying we specialize, my clinic has right now me and three other acupuncturists. About 25% of our patient load is fertility support, menstrual health, support through pregnancy, and then labor induction, breech birth, I guess fetal malposition syndrome is what they call it, but we actually help correct that too. So there's a huge amount of research on this modern day, but all of this comes back from thousands and thousands of years of doctors writing about how they helped women get pregnant, stay pregnant, and be healthy through labor and delivery. So it's absolutely amazing. Now, you asked when would we employ acupuncture over cupping? Certainly, there's a lot of overlap. Cupping is a little bit more non-specific, where if we just want to increase circulation to the tissue, we can kind of hit a big area with a couple of cups. Now, acupuncture, on top of acupuncture's effect on bringing circulation to an area, um, it's a little bit more specific, but when we put those needles in, we're also getting what's called point specificity. That means that list of functions that that point has. If your body needs it, it's going to do that. Now, if your body doesn't need it, acupuncture is kind of amazing where it won't like hyper regulate something. So if you're having a problem in an area, it'll help normalize it. It won't make it spike, right? So we use a lot of points that we can actually say increase white blood cell function and count in some cases. But if your white blood cells are normal or they're raised because you're sick, it's not going to skyrocket them, right? So a lot of people ask that when they come in with certain disorders. Oh, I have too many platelets. You're going to make more platelets. No, it's not like that. It will aim your body at what is normal, which is crazy. There's not too many therapies that do that, right? So to have that ability to do those things, it's amazing, and it all comes down to getting your body to do what it's supposed to do, and it's how you signal your body that, hey, this is too much, hey, that's too little. Acupuncture, above all else, and cupping to a big part too, regulates autonomic nervous system function, right? And that's a buzzword, right? We're all talking about vagal tone and fight or flight, rest and digest, and oh my God, let's do some box breathing to regulate. Yeah, so we're saying it 1,000 different ways, and there's so many different ways to regulate that. But acupuncture, after 10 or 15 minutes, we switch the body out of fight or flight and put them into rest and digest. We started studying that back in the 90s, and it kind of looks like this overarching effect that kind of helps the body regulate in every area. We know that we're in rest and digest. We're getting more circulation to all the tissue, including the glands. So we're having better hormone production, or more regulated hormone production, I should say. We know that we're flooding the brain. not only with fresh blood and oxygen, but with good neurotransmitters. We're balancing serotonin and dopamine. We used to think it was all endorphin response, right? And there is some endorphins released, naturally occurring. It looks like morphine. It's a painkiller. But in the 90s, we also discovered this system called the endocannabinoid system. So endo, once again, internal cannabinoid from cannabis. We have receptors all over our nervous system, CB1 receptors, and then we have CB2 receptors on our immune system organs. What'll happen is when we get acupuncture, when we ingest cannabis, or when we exercise or we eat chocolate, we light this system up. Now, our body makes one called anandamide. And I love this one because ananda is Sanskrit for bliss. This is the bliss compound, and it bonds to all those receptors on the nervous system. So it helps deal with pain and peripheral nerves, but it helps stimulate the brain for this feeling of bliss. So a lot of people walk out of our clinic kind of floaty. You know, they're fine to drive, they're okay with all that, but they're not having the pain or the stress, right? So they get this window, this break, right? And it's not a drug-induced break. So when they come back down, they reset that central nervous system or that autonomic nervous system response. That fight or flight isn't as high. So they're functioning a little bit better. And that's one of the main ways that we restore health with acupuncture.
That is so beautiful. And I love that it's basically just activating something in the body that seeks homeostasis rather than just bringing up whatever you're triggering there. But yeah, what exactly is the mechanism behind acupuncture? Because I mean, just putting a needle somewhere and then
Yeah.
like, does it have to do with the nerves or excuse my ignorance there? But yeah, how
Well,
exactly?
you're asking the $20 million question, because we classically we would say all of these functions that happen with acupuncture. We can talk about regulation of circadian rhythms. We can talk about immune system response. We can talk about all of these things. And yes, autonomic nervous system function is at play there, but it's not the only driving force. What people thousands of years ago figured out without knowing these modern day terms is that acupuncture causes this cascade effect, right? So they called it chi, they called it energy, right? Because they didn't have a better word for it. Now we have all these modern studies, and at the last count, I think it was over 32,000 systematic reviews in the Cochrane database, which is one of the major PubMed's one. Cochrane database is another, but all of these studies are seeing all of these functions, and they're trying to tease out, is it this hormone being released? Is it that? And they're showing those things happen. But when we go back, it's like, oh, we say we don't know why. We can, in Japan, they'll call an acupuncture needle an artificial splinter. And okay, something breaks the surface of the skin, we send fresh blood there. All right. That's a pretty straightforward one. We can all understand that. But all of these other effects that happen systemically, we're still going, oh, it's got to be the chi, right? It's not, chi was never meant to be something mystical in Asia. When it came to the West, that's when people that look like us turned it into this new agey kind of thing. And for as long as people have been doing acupuncture, those have been physicians. They weren't teased out to being like, oh, this is just the acupuncturist, like, this sub set of healthcare practitioners. It is a very Western thing. But all of those effects, we know they happen. We can document that they're happening. We can see brain activity changing, and it'll mimic, meditation brain waves while you're getting acupuncture, but we don't know why. But that's kind of like there's an expression, and I don't know it in Chinese. I know it in Japanese, but I won't ruin anybody's ears. It says the mystery of the mind spirit needle. They have this word kokoro, which means heart if we think about it directly, but the psycho-emotional components as well. And they'll say the mystery of the kokoro needle, right? And the idea is this needle has this effect on not just the physical body, the psycho-emotional body, the spiritual body, and it regulates all of these systems. So it's very weird, and we're kind of like, and people even today will say, do the channels exist? Do the points exist? And we're like, well, that's a great question. Like, we can say, if I put the needle here, these physiological things change. We have a needle that a point that we say, oh, this point strengthens the immune system, and we can monitor an increase in white blood cell production. but we can't even say whether that channel that it's on is really real or is it just a nice way to string those components together. We know there's a neurological effect. We know there's a blood flow effect. These points are near blood vessels and nerves, but they're not in it. So if they're not directly stimulating, is there something else? And I mean, you asked a great question, and that's about as best as I can give you. I can talk in circles around it because there isn't a definitive yes or no.
I actually think
We
that's quite beautiful though, because I mean, yeah, it's the body in the end is not a machine after all, but it's nice and wonderful to think that over the last, I don't know how many thousand years, people have kind of been so in touch with the body to figure
Mhm.
that out or figure out methods to tap into that. And other things where I don't think we have a well, I think more and more research probably coming out on that, but something we mentioned before recording was red light therapy, and that is also
Mhm.
something that you do at your practice. And maybe you can tell us what that is actually helpful for,
Yeah.
how that functions.
Yeah. So we offer a lot of services at our clinic. And, as an acupuncturist, I actually got a lot of grief from colleagues because they're like, that's not Chinese medicine. That's not East Asian medicine. Oh, we don't use cold in Chinese medicine. And I think some of that might have some root. And then some of that is you don't understand how big East Asian medicine is. And when we look at the overarching effects of things like red light therapy, in my head, it does a lot of things that acupuncture and Chinese medicine do, right? Reduce inflammation, increase circulation, right? So red light therapy, if we want to get a little bit, and you sound a little bit more scientific, so I'll give you a little bit more here than just the, oh, you lay in the red light and things get better. We know that red light, specifically the frequencies of red and near infrared, so that's 600 to 660, and then near infrared's like 680 and a little higher. Those sections of frequency, that red light penetrates the upper level. It penetrates the skin, some of the fascia, just maybe superficial muscle, depending on the area. Um, and we know that near kind of penetrates into the muscular levels. When that light hits the body, and we are beings that need sunlight, and this red light is throughout the day by the sun, highest in the morning and the afternoons, sunrise, sunset times. Those light rays stimulate the mitochondria in your cells to produce more cellular energy. They stimulate the Krebs or the electron transport chain to start kicking out more ATP, cellular energy, adenosine triphosphate. That allows your cells to have more energy to regulate cellular metabolism, increase circulation, repair themselves, replicate, heal your body. On a global scale, looking at your whole body, it's going to increase circulation, which is further going to release metabolic waste from tissue and get that processed and reduce inflammation. It's a big buzz treatment for like facial rejuvenation because it produces collagen when it does that. So it makes your skin look tighter, and they sell all the masks that you put over your face. The units we have, you don't need to be that close to. They're about a foot away from you on each side, giving you about a 20-minute treatment, and you get a whole body effect, right? So some people will use it for pain management because it's reducing inflammation. Some people use it as anti-aging because it's going to make you look younger, and also help those cells replicate and be healthier. So it's great because what is it? Biophotomodulation is the field, the study of light therapy, has been studying red light, blue light, all these things for well over 40 years. And it's absolutely amazing that, the more and more we live a natural lifestyle, we're outside more, we're getting hot more, we're getting cold more. You can knock out like half the services at my office. And I joke about that our modern lifestyle doesn't allow that. Imagine if we were out in the woods during the most days, getting whatever weather was there. So we're going to get cold in the winter. We're going to get warm in the summer. We're going to get daylight when we're supposed to. We're going to go to sleep when it's dark. We've knocked out all of these problems that we've caused by modern lifestyle. We can talk about food and that as well. But really, if we were doing those things, we'd be moving our bodies all day. We wouldn't have to hit the gym like we do. We wouldn't have to be going like, we're not going to catch a Happy Meal in the river. We're going to have natural foods. So it's funny to say that, like, I'm well aware that if people just were more in tune with nature, my clinic wouldn't have to be. It's like I wouldn't have to do this. It'd be a lot easier for everybody. Yeah, Oh, I think you're mute.
Yes, I was just going to say, generally, I think it's a really good point that we do have to go back to more ancient type days. I think, is it called the Paleolithic deficit or so that we're experiencing now, just by
Hmm.
being so far removed from how we were intended to live, essentially. In particular, with the red light therapy, is there any application with skin conditions like psoriasis or anything like
Yeah,
that as
yeah.
well?
And a big part of that is getting more cellular energy to that surface tissue, right? So we're going to give that part of the body more ability to heal. We have people that are using it for severe eczema. Even we currently have somebody that's doing great with steroid induced eczema. So
Right.
what happened is they gave her too much, so she had eczema. They gave her a lot of steroids to suppress it, and her whole body was covered in eczema. So she's been doing red light probably about 4 or 5 times a week
Oh.
at our clinic and has really made an improvement between that and acupuncture. And then we also have her doing salt therapy. Now, salt, we normally do it for respiration, right? So you're inhaling about 3 tablespoons of microfine salt during that time, but it's also hitting your skin. So we're essentially giving her like a beach day every day. But it's working very well, and along with acupuncture to help regulate the immune system and maybe tame some of that immune system response. Uh, I'm actually very surprised at the results. It's quite amazing.
Oh, amazing. Very cool. Yeah, I mean, I'm aware that a lot of people with skin conditions like that are instructed or recommended to move to more beach sort of climates as
Mhm.
well. But I mean, of course, not everyone has the luxury to do so. So that is a
No.
great alternative for sure. But you have another type of therapy. I mean, again, you offer so many wonderful things. I believe is it oxygen?
Yeah. Are you stalking me?
A little bit. Well, I try
Well,
to do
got
my
to do some
research.
research, right? Yeah. Yeah. And you know what? To tell you the truth, I'm glad you mentioned the oxygen, right? Because oxygen, when we activate that electron transport chain with the red light, one of our favorite stacks at the office is to use exercise with oxygen therapy alongside of the red light. Now, we know that an important part of cellular energy production is that oxygen, right? If we don't breathe, we die. But on a cellular level, the more oxygen we can get into that tissue, into that mitochondria, the more potential we have. So we do exercise with oxygen therapy. We used to have a hyperbaric chamber. I loved the hyperbaric. The problem is to really do hyperbaric right and to really help people, you need to do about an hour, 6 days a week, 7 days a week. And the cost of renting a soft hyperbaric chamber, it's cheaper and more efficient, more effective for my patients to actually rent one of those, put it in their basement, put it in their spare room for a couple of months. I can't charge low enough and I can't get people to my office every day. So if people rent them, they can use them 2 hours a day if they wanted to. The other thing, basically hyperbaric, high pressure pushes oxygen into the liquid part of your body, right? It's using that pressure to squeeze about 30% more serum oxygen, so into the liquid part. You're not getting more than 100% on red blood cells ever. That's 100 is top. But the liquid part can hold an indefinite amount. There's probably an upper limit. I don't know it. But what happens is just because the pressure is about 15 feet, 3 to 5 meters with the pressure, um, underwater. So sometimes they'll call hyperbaric diving. Oh, I went for an hour long dive. Okay. But that pressure will increase that serum oxygen about 30%. That lasts about 3 hours with a hyperbaric. with exercise with oxygen therapy. And I actually had to talk to a respiratory therapist about this because I thought I was being lied to by the company. In a 15 to 20-minute workout. And basically, it consists of what looks like a CPAP mask. So you're wearing a mask over your face. It's hooked up to a bag that has about 95% pure oxygen in it. And then there's a smaller bag that has high altitude air. Somebody figured out they can run an exhaust off an oxygen concentrator and get about 14% oxygen. So that's our high altitude air. So what you'll do is you'll do a warm up, and we customize this to everybody's fitness level. So we have people coming with TBI. We have people that are coming in with chronic disease. They're not going to be like what you do as somebody that's like active fitness, high, somebody that could run a marathon. Yes, that's a different game than a lot of our patients, but we can customize this to where everybody's at. So they'll do a warm up and just concentrate, make sure the red blood cells are as soaked with oxygen as they can. Then they're going to do a sprint. When they do the sprint, we switch the bag to the high altitude air. So they're sprinting at high altitude. And we see some people, like especially some runners and things, they'll train with an oxygen mask to keep like the oxygen from getting in there. So they're training with some air resistance. But we're doing this artificially in our clinic for a short little sprint, and that'll strip the red blood cells of oxygen. As that red blood cell drops, it changes the pH of the blood. So now you can off-gas CO2 more efficiently and absorb more oxygen. After that sprint, you switch back to the 95% oxygen. Now your body goes, oh my God, I nearly passed out there. And you won't pass out. We can't get you lower than 80% oxygen. We've tried. And it'll stockpile that oxygen in the liquid part of the blood. So now we can repeat that several times. We sprint. Your body goes, oh no, there's no oxygen on the red blood cells. We need more oxygen. Then we switch back and you recover, and your body's going to hold on to more oxygen. Now, the company we bought our machine from, and I'm not going to endorse them, don't worry, they said about 433% more serum oxygen. And I went, there's no way in hell that can happen. A respiratory tech that came into my office said, no, that's not impossible. That doesn't sound too crazy. It lasts for 3 days. So now as a practitioner, I can get you to come in my office twice a week for 20 minutes. That's much more reasonable than 7 days a week for an hour. So why wouldn't I do that? And our patients love it. We get a lot of athletes that come in. We get a lot of TBI, brain injury. I feel like some of the autistic patients like the hyperbaric a little bit better. It was a little bit more comfortable with the squeeze for them. But we're trying our best, and people who actually use that bike love it. They love it. And you can do it on a trampoline, you can do it on a treadmill. It just so happens we've got a recumbent bike for people that's a little bit easier for, and then we have an AI bike that actually monitors how fast you pedal. If you do some calibration rides, and takes you just to the brink of muscle fatigue and burnout. It's really a cool little machine.
It sounds super intriguing. I would love to give it a try. Although, I mean, I'm quite used to altitude adaptation as I live at almost 14 feet or so. But nonetheless, training with a machine like that still sounds really cool, particularly with pairing it with sprints and so on. So really, really interesting. I love what you're all exploring. Do you have anything else on the horizon where you're diving into this, or a new book that interests you or anything like that?
I think the cupping book and kind of thinking around what can people do at home. It started to kind of like, I just kind of get under my skin, I guess, that we kind of threw out all of these traditional medicines. Oh, it's folk medicine. Oh, it's pseudoscience. Oh, it's this. No, it's that. And sure enough, like I gave a lecture to the hospital system through the military here. And I was just trying to show them how weird I was. And it was around Halloween last year. And I'm like, let's talk about gross stuff. Let's talk about gross stuff from traditional medicine that has modern day use, right? So we talked about maggot therapy. We talked about leeches. We talked about fecal transplant. We talked about eating human placenta and its connection to stem cells. And here's a room full of doctors that I was like, isn't this weird? And they're all like, let me tell you how we're using leeches now. Let me tell you how we're using maggots now. And it's like, Oh, now because you now because you it's not associated with traditional medicine, we can reclaim it. So it became very intriguing to me. Like, what else do we let go of? The curanderos in South America, what do they know? I recently, probably about a year ago, and I just talked to the shaman today, oddly, which sounds, it's so serendipitous. But I did combo about a year and a half ago, which is toad venom. They burn a hole in your skin and then you vomit violently. It sounds horrible, but it was amazing experience for me. And that shaman, during a plague, saw his tribe dying, did ayahuasca, and the ayahuasca told him, here's this tree frog. Here's how you get the venom from it. Here's how you apply the venom to your people. And here's how the whole ceremony goes down. And there's like something like 5,000 compounds in that venom. And yes, it's an emetic. It makes you throw up, but you're clearing out so much stuff. So in my head, it's like, where can we find that right balance of like, we're going to look at things critically. Yes, there needs to be some research, but here's traditional use and what's the value there? And that's really starting to, I'm pushing 50. Maybe it's a midlife crisis for me. I don't want a Ferrari. I want like, hey, what kind of cool stuff can we do that's been around for 1,000 years and how can it help people? The other reason I'm doing it is because cupping, you read this little book, it's 130 pages. It's not a heavy read. I meant it to be like, what would grandma tell you? And then you go out and buy a $20 cupping set it's silicone. It's going to last you your whole life. And now you can treat yourself, you can treat your family, you can treat your friends. And not only does that tradition live on, but everyone that experiences that has a healthier life, right? It's richer. You're going to run better. You're going to take better care of another person, and that seems uh, sadly lacking. And like we don't have that compassion that we all talk about, like that we should have. So I'm hoping that these classical therapies, whether they came from shaman or physicians or whether it was somebody going into a trance and divining something crazy, if it has therapeutic value and it's connected to humanity, and I mean that as like all parts of us, um, it should be held in regard and used when it's appropriate. And that's starting to become a little bit of a passion project for me now.
I love it because it's not just a personal passion project. You're spreading such a wonderful message to everyone around you, and I think, especially with a book, I mean, a wide reach. So not just in your clinic as well. So truly, thank you for doing so. I'm of course going to link all your handles and the book into the show notes as well. So please, everyone, go and check it out, and also check out the Instagram page where you put out some helpful information on there as well. But all in all, I just want to thank you for your time and for sharing your wisdom with us. Keep exploring all these different avenues and spread the knowledge that you find. So yeah, thank you.
Oh, thank you so much for having me, Lisa. This was absolutely a delight.